Well, you're welcome. Some of you may have been here this morning, so hopefully you'll have to bear with maybe some similar things, but I never give the same talk twice anyway. Just whatever story comes to mind about a clinical case may be different from one time to another. So I hope you're all well fed, and for those of you who are tea drinkers, you may have been without tea because the water was a little on the cool side. But being from Ireland, I'm the tea drinker. Anyway, it seems like it's a little warmer than it was this morning, thank goodness, because I think it was very cold. Okay, which I don't think that freeze brain does much for you either, because you're so busy trying to keep warm, it's hard to concentrate. I guess it's one extreme or the other, right? Okay. So, women and girls, sacred to my heart for sure, so long misunderstood and overlooked. Did you know that women and girls don't have ADHD? You're laughing, but it's not that long, seriously. Back in even the 80s, people still thought it was a male gender disorder. Glad to see so many women in the room, as well as the men. And it was only when people were seeing it in their clinics, and even the researchers, Arnold and Hinshaw and all these bigwigs, that they thought that this was completely needed much more investigation. But then that was in 1994 when they started doing a National Institute of Mental Health kind of study, and then published in 96 about it does obviously occur, and it's not being diagnosed. They're flying under the radar. So they decided there was backwards and forwards. Should they have a different rating scale? Are we picking them up? Is it everything based on little boys? And they came up with the fact that perhaps the core symptoms are similar, but maybe the way they present may be more difficult and are different and challenging. So, okay, I speak for lots of people. Learning objectives, but everything I speak about is from my experience and heart and my passion in this area. And I'll tell you that when I came to Canada first, a lot younger than I am now and way back in my residency, I was lucky enough actually to have gone through a program in pediatrics with two physicians who were just excellent and real game changers in the area of ADHD. One of whom, and then the second joined him, and then I was lucky enough in the third edition, actually wrote the first book in the English language on ADHD. Took a sabbatical and went and wrote it for parents, really, because there was so little information out there. Now it's everywhere, but there wasn't. When I came first, I thought, oh my goodness, what are these doctors doing? They're putting badly behaved little boys, as I thought, on drugs. And in Ireland, I hadn't heard of that, didn't know what this ADHD was, and I was very respectful, or, I didn't say anything, but I was kind of shocked. So when they returned from their trials and things like that, which was very basic back in those days. We didn't have all the array of strategies and things, but they always used strategies, always believed in strategies as well as medication. And what struck me was not just the fact that they could do their math better or sit in the class or put their hand up. What really struck me was the fact that the quality of their relationships could improve. They could be invited now to birthday parties for the first time. Granny would have them over for Sunday lunch and say, oh, he's matured. The kids would say to me, I can hear the teacher better. Or people are nicer to me. I have more friends. Not realizing the part that they would have played, they were able to step back a little bit and have more control and make better choices, because basically they're good kids, but foot and mouth disease, as I say, before they say it. Or as I was saying to my audience this morning, a teacher came up with this phrase, because one of my little boys last week said, when we were talking about a similar thing, he said, oh, that's what my teacher, Mr. So-and-so, calls blurty outy-itis. you know, like that just blurt, they say stuff before they mean it. And I thought, well, that's really cute. I think I'm going to use that. So how do females differ and how are they the same? Okay, we'll talk about some of the similarities and differences as we go along. I mentioned this morning, good place to start, just to remind all of you. I know you know about ADHD and what the core symptoms are, hyperactivity, impulsivity, and hyperactivity, impulsivity, and attention, but attention is the one that's common denominator through, but some are both hyper, impulsive, and inattentive. The girls tend to be more on the inattentive side, at least in the original, when they're younger. So really, I want you to think about it as a neurobiological, neurodevelopmental disorder. And that's really important because before, I always put that down because I did not like this category called disruptive behavior disorder, which the category was under. So I kind of use that, but now I'm legitimate because it's neurodevelopmental disorder. It's changed to. So I like that much better. It gives a better understanding. Because otherwise people think they're just choosing to behave badly. Men and women, you know, is there a difference? Is this a validated diagnosis? Yes, it's one of the most validated diagnoses there is. According to all the literature, it's been around for 2 centuries. It's been talked about since Still's time. It's been different names, different changes, but more or less the criteria have kind of remained the same, refining it, defining it. Getting information from everybody, as much collaborative evidence as possible, is really the gold standard. Because I still hear this from some of the adult psychiatrists. They'll say, well, how do we know it's ADHD? Aren't they just scamming it? You know, can't they just, anybody fill out one of those questionnaires and score it, whatever? Well, I'm a little astonished because that's not how you diagnose ADHD. Yes, there's a criteria to meet, but without listening to their story, because there's no special test, you're going to miss the whole boat. No two people are the same, as I said. Really interesting, different sets of skills and challenges, etc. So if they don't listen to the story, they miss the point. And I mentioned even this morning that sometimes the ADHD people will actually fill out the forms, and you have to move it for them because they get sidetracked and fill in the wrong line, or they forget to tell you that, or they put not at all losing or forgetting, and I said, wait a minute, aren't you on your 3rd set of keys in the last year? And what about the fact that you have had to replace your cell phone, and now you don't know where your credit card was because there was a problem you said in the store the other day? Oh, okay. So I give them an example, get an example, give an example. So anybody who doesn't do that really is not taking a really good history. So you come up with your examples yourselves. So 2 years ago, there was a change from DSM-4. The good thing was, instead of having to remember from the age of 7, way back before the age of 7, did you have any of these symptoms? They've brought it up to the age of 12. Still some people can't remember back that far, or they have illusions or disillusions about what actually took place. So you have to kind of sift through that as well. And the other thing is that if you're 17 and older, instead of having to have 6 out of a possible 9 criteria, you need to only have 5. But it's still based on clinical judgment. And autism spectrum disorder is now allowed to also have ADHD. Well, we knew that. As clinicians, we've been ignoring the rule you couldn't diagnose them for years and always included them to positive results, because if they're able to be less anxious because now they can focus and listen better and follow on with the skills, then they can actually do better socially. That's what I've seen, and present a paper on that. So, and luckily now, instead of all to do with school books and sport, you know, kids' games and things like that, they now have talked about adult impairments. They're giving examples now so that the family docs and other people who are not as familiar with this can actually get it. Oh yeah, he's on a 6 pair of reading glasses. He's got one every place. He still can't find them, you know, that kind of thing. It's a lifelong disorder from the cradle to the grave, okay? They talk about into adulthood about 70%. I think sometimes they may not meet the criteria, because they have maybe not showing as many symptoms, but maybe their impairments are huge. Okay, so it's really important, and I talked about that last time, that we look behind and see what's going on. Okay, what are they masking? At what cost is it to the individual? Okay, they're staying up hours to do things, get the homework done, etc., the housework done. So how do they present across the lifespan? In preschool, actually, males and females look pretty much the same if you're diagnosing them. They're both at the severe end of the spectrum. Because if you're raising flags in preschool, then your problems are going to be more severe than somebody who maybe is presenting in high school in a different way. Because now when we're in preschool and we're in elementary, we're looking at self-control, self-regulation, staying in your seat, all of those kinds of things. And the boys tend to have more problems with that than the girls. They're in and out of the washroom, they're sharpening their pencils. I've had kids banned from sharpening pencils because they're up there all the time and there's no pencils left. Going for a glass of water, go to the bathroom, never come back. But I've seen the girls where they can be just as hyper and aggressive and as some of the boys. I will say, though, that even though you can make the diagnosis, I've, probably on two hands, even though this is my area of specialty for many, many years, I have not actually diagnosed a huge amount, because I think you really need to look at everything, the environment, put things in place, and also a specialist in ADHD, in pediatrics or child and adolescent psychiatry should really be making those diagnoses, because there are too many things about developmental issues to factor in and factor out. So by the age of 4, most kids should be able to follow at least one step direction to complete a task. They should have developed self-regulation, some decent self-regulation appropriate for that age. Barkley talks about that. There are other studies out there. And also helping them in that is the self-talk. So their little brain is telling them what to do, what to say. And keep it screened into our indoor voice. But as I said, I often will do that at the end of the day if I'm gathering up things. Oh yeah, there's over there, here's her. Sometimes it helps to externalize it. Elementary school. Well, if you haven't picked it up in ECS or preschool, and the grade 1 for those kids who are really hyperactive and impulsive and inattentive, it really becomes apparent. Because it's all day now, and you can't make all those nice little choices that you could in kindergarten and get by. Oh, he just loves to play with the whatever center, and they're bright and they're learning all the other skills. So completing tasks, hand up, all of that. So in elementary school, the girls may not be again as apparent because they're eager to please. They have the friendships, things aren't as sophisticated, and they can certainly get by. Middle school, I don't know if you have middle school here in BC. We have in some places in Alberta, and then other places we have a junior high, which is awful, I think, and a senior high, because in junior high we have grades 7, 8, and 9. Middle school, they have, 5, 6, 7, 8? Anyway, it's when they change and we have the expectations change. We have juggling how many different teachers? We're juggling lockers for the first time, maybe. We're juggling the fact that responsibilities have increased to the fact that instead of learning to read or staying in your seat and controlling yourself, you're now supposed to be responsible for getting work done on time, handing it in on time, and you don't get the same reminders if you were in elementary with one teacher, thankfully phoning home to say they didn't bring in their assignment. Parents are on top of things, they drive in with it, maybe if they're not too far away, and there's a lot of scaffolding going on. Of course, that's the time that in some kids, and going into high school, we have hormonal changes, puberty. Parents don't know anything anymore. They used to, now they don't. They're trying to keep up with the peer relationships and juggle all that we've talked about. So that can be a pretty overwhelming time. And middle school and high school may be the first time that some of these girls start to show, because now they're becoming more frustrated. It's harder for them to focus. They can be very bright, maybe, but they're still blanking out and missing instructions and not coming home with the right things. And at home, they can have maybe a toxic relationship with their family, even though the school might be shocked to hear that. Oh, not Jane, she's such a pleasant girl. She's so motivated to please. She's so organized. She has all those nice stickies and pens and highlights, but is she getting her work done? Well, she's spending time at home, spending maybe 14 hours over a weekend trying to get a project done, instead of somebody else taking, 3 or 4 hours for the whole project. So it's at great cost to their friendships, to their hobbies, and they become extremely frustrated. So the first person they'll take it on are the parents. But it is a compliment, because it's a sign they do love you, they feel safe, they're not going to do that. Other kids do it everywhere, they explode everywhere, phone calls from the school. So in one way, you can be grateful, but imagining they're bottling up that all day. And then so we can get some anxiety traits, because now they're in a panic, they're rushing out the door, they've forgotten, they sat up at night to do it on the Sunday night for the Monday morning, rushing around, getting everybody in the house all up in a tizzy. Oh, I haven't got my books, I need to get it done. And then they may rush out the door and totally forget the assignment after putting all that effort into it. Who on earth would do that to themselves on purpose? And yet they get blamed. Well, you should have remembered, and the whole thing. They're feeling badly enough, and so they can become demoralized and believe that they are bad, and that they're not producing as much as their other friends, so therefore they can't be as clever. They have that kind of little radar that some of the guys might not have. They're just busy getting by, rushing, get out to the playground and kind of horse around with the boys. Conversation is also in higher demand. I mean, boys do, they're out there doing stuff, and the girls are often chatting. And if you're blanking out in conversation, even if you're a nice kid, they start to kind of ignore you after a while. So they may not dislike you, but they may not include you because, well, she's a bit of a space cadet, so. You come the next day and you say something, and they said, but we all talked about that yesterday. You don't care. Why aren't you, listening? You're not doing your part, that sort of thing. So they may get blamed. The more hyper-impulsive girls who are on the more aggressive side and the bossy side, can be extremely rejected and disliked. And there's nothing like, boys might get out in the playground and have a fight over it physically, but the girls can be quite a lot more vicious. They band everybody and turn everybody against you, and you're left out. And then you come home and maybe you're keeping it to yourself, and it can be quite sad. So the internalization goes on. Young adulthood. Well, some of these girls really get through high school, and I found that the ones who see me in grade 11, 10, or 12, they're usually from high-functioning families, and the ones who've gone to university, who have caring, supportive morals. They're scaffolding their children. They don't realize that we talked about they're handing them things. Here you go. Have you got that? Have you got this assignment done? Drive. And they may be actually, I find, really highly scheduled, so that they have belonged to so many activities. Other people might go, oh my God, you can't, that's terrible to do that to your child. Give them a break. Let them be kids. And I'm all for free play and pretending and the whole thing, because we certainly didn't have any electronics growing up, and you had to make up a lot of things, be a detective, do whatever. It was kind of fun. But these girls really, once they leave home or once they stop doing the overscheduling, so what happens is they're into competitive swimming or they're competitive skating. I mean, that's great skills, but still, they may arrive without their swimsuit, they may forget on the ski slope, and they may arrive without the boot or one glove, etc. Now, if they're good socially, people will kind of marry around them and say, don't forget this, we'll collect you because you'll be late, So you can have good, not all kids with ADHD have bad social skills or difficulties. Some of them can be very charismatic, and some of these girls that are impulsive and the hyper chatty Cathy kind can be very exciting to be around. So they can have a whole parade of people doing things for them, and you don't even notice because it's just happening everywhere. And then the other kids that are ignored and left out. So everybody, okay, we've got swimming, now we've got piano, here's your snack, this is homework, we have to get it done in this half an hour because now we're on to this next, okay? So some of them just thrive on that. But then they get this notion around grade 11, oh, well, you know, I want to go into law school, or I want to go into whatever. I really should quit this stuff and really focus on my homework, or really focus on my work. Well, very interesting, they don't do as well, because now what have they got? They have time to procrastinate. Okay? They think, oh, well, I've got all this length of time. So the hours get longer, and the time to fill it up, they're, you know, again, going around collecting to get started. Maybe you've got all these lovely stickies and this, and it takes them so long to get, they look organized, but they're not getting started. They usually need that deadline still. So that's why they're up late, or it's in a crisis, etc. Got the adrenaline going. And people say, why didn't you, knew you had this assignment, etc. So that's when I may see some of these girls. But they were getting marks in the 80s and 90s, and the teachers thought, that was crazy. You're crazy parents. What are you doing taking this girl to be assessed? But the girls know it themselves. They know that they're not able to focus, that they've just been getting by, and now the grades are getting higher, the demands are getting higher, and so they start to become panicky and overwhelmed. So very interesting to listen to their story, because they can be very self-aware. Even though you might get a 0 from rating from school, and not that much from the parent, but from the girl themselves, you can get a very insightful picture. Oh yeah, blanking out. You can see it in my office. I see you're talking to them and they're all keen, and the next thing it's like, oh, what were we just talking about? What was I just saying? You know, they lose midair. But if they're quiet and they don't bring attention to themselves in the class, then nobody's aware of that. They look like they're focused, but they have to put a lot of effort in at home to do that. And again, particularly if they're bright. And then people think, oh, they're just looking for accommodation. They're just looking for a diagnosis so they can get all these aids. You can't really fake it. I mean, you can fake questionnaires, but you can't fake the story again when you start listening to that. No one's the same. So then we go to college, and all that scaffolding is gone. God forbid it if you go to Halifax and you live in Calgary, or I've had some of them, or Carleton and you live in Calgary, or BC. Now you're left to the mercies of yourself. So they make it to the wrong classes. If they're on meds, they forget them. They often fail their first or second year, even though they went in with really stellar marks. So some of them actually come home so that they can have that structure again, or they get diagnosed for the first time there, and there are student services places. Does it affect the workplace? Well, of course. We hear these horror stories about people changing jobs a million times and getting fired, and they're late. They're, you know, losing their temper with the boss. They expect they should be the manager when they're just starting as the dishwasher, you know, those sorts of things. But we also have, on the other hand, people who are extremely successful at their jobs with ADHD. They're passionate about what they do. They're bright. They've put a lot of all this effort sideways along the way that people don't even know about. And they're the top judge, or they're the top principal, or they're whatever. And so people say, well, they can't have ADHD. Look at how good they are. Wow. You know, they're so focused. It's kind of like being the workaholic. You can be focused in some of the workplace because maybe you have scaffolding going on there too, particularly if you're a guy. They're often the secretaries and other people to get you going. Remember this appointment, such and such, you know, the whole thing. In the old days, I think they even got their clothes taken to the dry cleaners and things like that. So with the women, that can happen too in some of the higher places. But then what happens is they may not have a partner. Whereas the man might go home to have the partner who's the organized one, and they're taking care of the kids and the household. Well, if you're the woman and you're the one happens to have ADHD as well, but you're surviving in the workplace, you should hear some of the stories of how they survive. They're getting up 3 hours earlier so they can have all their belongings. And if they run out the door without things, they can come back. And they have double sets of things at the office and at home, and literally there's no life in between for some of the young ones who they're not in either, there's no time for relationships, or they're not married, or don't have any spouses or children. So it can be just as tough on them. I have one girl that comes to mind because lots of them have gone into their second degrees, have their second degrees, but I remember this one. I'll call her Backup Betty, because honest to goodness, she's just amazing. Her mother didn't notice a thing, because she said her mother was a teacher who had ADHD, was overly structured with everything, stickies everywhere, and was scaffolding her so much that she didn't notice. But they lived next to the school, so she'd just have to go next door and grab the stuff that was left behind. And Mom, the teacher, would be able to find out what was needed to be done. Dad did remember coming home without the right books, and the emotional breakdown at home. And she said that she was even sitting on her own with the suitcases in the back seat of the car, because she was poking and yabbering and, going on and on, that they wanted some peace, So this is stuff that Mom had actually written 0 out of 9. That was the memory back. So that's what I'm saying. Sometimes you have to really look further than that. And but Dad remembered a bit more, but she extended her university 3 years to 5 years. She did work in between. She moved to a smaller university, so she got her degree. And she was in law, and she was getting into her second year, but she was doing all this stuff. She told me that she had forgotten and lost so many Visa cards or other credit cards that she knew that this was a real weakness. So she'd always have another one apply and ready to go, because that was such a catastrophe for her. So she was always backing herself up, if you like. So that's why I kind of christened her Backup Betty. That wasn't her name, of course, but so she had all these strategies. So if you didn't take away all these supports, on the surface she's so successful, you didn't ask those questions and wind your way through it, you wouldn't know. What do you mean? You're going into second year law. You've got this articling thing. They think you're great, Yeah, but they don't realize what's going on behind it when she gets home, and how long it takes her to get herself organized, and that she's just time to go to sleep. Again, so that obviously no time for relationships. And when you have in the workforce, as I said, coming home from the workforce that you're passionate about, it's tough. Now you come home to a house. It's a very, very, as Kathleen Nadeau says, ADHD unfriendly place. Wow. You have, should I do this? Should I start doing the dishes? Should I do this? Oh, the kids need their homework done. I have to pick up Johnny. Oh, the groceries. It's a nightmare. The laundry, the whole thing. And let's face it, are any of those tasks really enjoyable with all those chores to do? Not really. So again, procrastination. So you have to do that reward thing that we talked about in my last talk. When I get this done, then I will reward myself with a book, a TV program, a game with the kids, whatever it is, a cup of coffee, okay, constantly. But what happens is they come home, they may have managed their own life on their own, but now they have kids, and now they have often ADHD kids, as we talked about it being such a multi-generational hereditary problem. Twin studies show up there at 80%. It's one of the highest hereditary disorders there is in medicine, okay? It's just after height. And then it's before schizophrenia are up there with it, and then all the rest come much lower down. I know that's always a surprise for people, okay? So and the granny may be living in the family, and there may be 3 generations that have it as well. And so it can be somewhat chaotic, or one doesn't understand the other. So juggling all that thing at home, they may survive, but they may be up till 3 o'clock in the morning getting all the things done as well as their job. However, if they're very highly paid, they may be able to hire an organizer. I've had families do that, so that they could find where they were able to sit at the table, the dining room table, because they're all gifted, and a lot of them ADHD coming home, piling like I've done here, shelves of stuff, and where's that? Oh, it's under there, or, being able to afford to get pre-made good cooked foods for yourself, not just going and getting junk food and things like that. So there are ways, if you can figure it out, that you maybe hire a nanny, I don't know, have them do that. So what happens then? We have life skills that are disaster and chaos and dysfunction, and or else it's at the great cost. So you can imagine that even without the kids, marriage can be affected, because now you're living together. It was different when you're out on those lovely dates, right? Oh, everybody's in their best behavior, they're dressed nicely, you don't have to go for the groceries, you can go meet for coffee, go to a movie, you know, whatever it is, dinner, lovely. But when the day-to-day stuff and you've got your clothes spread all over and the other person's getting annoyed on the other side of the room and you haven't got the list done and there are no groceries and that was your responsibility, oh, you forgot, because sometimes they get carried away on their own electronic devices or the television or whatever it is. So that can really affect relationships. And then, of course, we talked about the parenting, which is a very tough job, even without ADHD and without children with ADHD. But add that into the common denominator and it's tough. So again, this is the classic picture everybody thinks of. Oh yeah, I know ADHD. This one says, beware of the hyperactive child. If you get his prescription, till you get his prescription filled, I suggest you post this sign on your lawn. That was kind of, you know, oh yeah, everybody's like that, little boy, I know it. They forget about all the other presentations. Like, for example, when we talk about relationships, my doctor told me I had attention deficits, something or other. I wasn't really paying attention. We can see how that will be doomed. What's the incidence? Well, everybody used to talk about boys more than girls, and in the younger years, yes, but it's not the 9-to-1 that people used to talk about years ago. They were the clinic referred cases. Only the severe girls, tip of the iceberg, got into some of those clinics, but out in the community, in the more natural settings, it's more like 2-to-1, 3-to-1, even in the younger age groups. Now, the boys outnumber the girls in the younger age groups for sure in all the different subtypes. But look at the adults, look at the incidence of adults. I mean, it's pretty much close to 1-to-1. And what's happened? Did they suddenly all develop ADHD? No, they were flying under the radar, they weren't picked up, they were coping, they were diagnosed with something else. But women are good at self-referring because they'll find out about it maybe through their own child. That might be the pathway. Or a co-worker. I've had people come in because their co-workers have sent them. Or maybe they're mentors in nursing practice, practicum programs or something. They see they're good, but then they look at the attention issues. So why do we have this? We have this gender gap, and it can happen. There's some studies out there that show even when some clinicians and teachers were given exactly the same little case vignettes, you know, of what the child was like, 3 or 4 of them. When the girls' names were switched to the boys' names, or vice versa, the boys got diagnosed, but the girls got diagnosed with something else. You know, it was learning, it was this, it was that. It was just sort of that mental kind of attitude was not surprising, I guess. And why is it like that? Because they could be very good in the classroom. You're, oh, she's such a lovely, so pleasant. So it's the squeaky wheel gets the attention off. And I feel like saying, you know, jump up and down and have a temper tantrum. And then the expectations. What are girls expected to do? They're expected to be quieter. They're expected to please. They're expected to sit a certain way. I had this little girl in the office. She turned 6, she was in grade 1. She was hilarious. She was so hyper, and she never stopped moving. And her legs were always even up in the air, you know, and she liked to wear dresses. So you can imagine the mother's embarrassment. And I'll just say this gender thing, because if the guy was there and his legs were up in the air, there would be no concern. She said, and I noticed that the girl had shorts on her as well as the dress. So that was cute. She said to me, oh, Dr. I had to put shorts on her because I noticed she was doing this, and she was in the other doctor's office it was so embarrassing, you know. So there are those expectations, not that she was aware of it at that stage, but at least the mother felt better because she had her shorts on. But a lot of girls nowadays wear jeans and, you know, tracksuit things. So it's, but that just stood out as well. And then, of course, we have the hormonal influences and fluctuations that change from puberty up and down throughout the life, perimenopause, menopause, etc. I'm going to talk about that a little bit later, but you can see that that's going to have an influence, whereas the guys don't have some of these same influences along the way. So we talk about it being hidden disorder because even if you're hyper as a girl, you're just busy. Oh yeah, she's busy. She's doing this. She's doing that. She doesn't like to be unoccupied. A bit restless, but they don't see that as kind of on the go. Adults will talk about that as maybe a more inner restlessness. And as people age, the hyperactivity tends to diminish in most, but around puberty. But the girls can be hyper talkative, okay, and hyper reactive, more emotional, and the talking, yak, 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 the whole thing nonstop. So, but that wouldn't be picked up again as being hyperactive. So we talked about the compensation, so I won't go on about that and the fact that they're inattentive. And then we have some males, of course, who also are inattentive, and those girls have kind of opened the way for them to get diagnosed. We have here Mr. Woodford, who's the teacher, looking out the window. You like Mr. Woodford? He has an attention deficit disorder. So kids kind of pick up on these things too. The teacher is either really organized and great. Some of the guys, they're the best. They have hit it off with the kids. They're great senses of humor. But it looked like Mr. Woodford maybe spacing out a little bit. We talked about the parenting, and this is definitely out there in the literature. There are also studies done, MASH is actually from Calgary as well, and they really, when they did this perinatal program, they just weren't able to function at the same level as the other non-ADHD kids. So even before the parents were born, they were focusing and doing the prenatal programs was very tough. Okay, we talked about tip of the iceberg. Dr. McIntosh talked a lot about that, so not going to belabor it, but really the main conditions that occur are anxiety. Why isn't that coming up? Well, it's too fancy for me. But anxiety would be the biggest. Oh, there we go. Well, I forgot it was so fancy. It got pinks and blues. So you can see that we have anxiety would be more comorbid in some of the females. Why? Because they tend to internalize, blame themselves, because they're told that it's their fault. The guys tend to externalize more, blame everybody else. I mean, there are girls who do that too. But it's, they get it out. It's your fault. You hadn't put that crumb on the thing. I wouldn't have tripped, and, whatever. So then they become more anxious and panicky and worried. Also, look at the depression here. A lot of females, 14%, have been treated for depression by the time when they were teens, okay, compared to the males. Again, demoralization, internalization, plus the comorbidity rate is higher. So we talked about the emotional stuff, and I talked about that this morning, about it's not personal. They can be drama kings or drama queens. So everything is mountains out of molehills. I can't do it, I'll never get it done, it's going to be disaster, and it's only something small, and somebody else is really irritated about that and say, will you stop doing, rather than just sort of using a calm or soothing voice saying, it's okay, like, they're there, it'll be fine, just step back, let's go here, do that. But their thing is to kind of overreact. And then they look like they're very dramatic. And so that can be good or bad. They can be excited dramatically, and that's can be exciting to be around, but they can also panic pretty easily as well. Talked a little bit, mentioned this morning that more and more there's a link with attention deficit disorder and obesity. Now that may seem like a surprise to some people, because forever in the beginning, I was always hearing about, the little boys, they're scrawny, you can play the harp in the ribs, they're, so thin, da-da-da. Well, I'd say even if you were on medication, this John, he's still moving around, he's in his seat, he's squirming. You don't medicate somebody till they don't fidget. It's until things improve in their life. But if even that could be their natural tendency. Oh yeah, his dad was just like that. He was a beanpole until he turned 40. Or some of them are still beanpoles. Or the other thing could be that the ADHD is more linked with being overweight and obesity, because what they do is this mindless eating. So I always ask about that, So when they're bored, do they kind of go to the cupboard, open it up, what's there, or this bag of crisps, they only meant to have one or two, they eat the whole bag, and they're watching television, and they go for the popcorn, and they've eaten their meals now. Some of them are really picky eaters, but these are people who have actually eaten their meals, and they're just sort of doing it out of something to do. And so the weight can creep up, because they're also not finding time or getting themselves motivated to do any exercise or be involved in other things as well. So Cortez is one of the big researchers in this area, and he's published a meta-analysis recently definitely linking that, okay? They also link eating disorders as well. So that the big link with eating disorders is the impulsivity, okay? It's not the hyperactivity, but that kind of impulsive eating. And there's a disorder called binge eating disorder, which is in the DSM-5 now. It's an actual diagnosis where people just think about their food, they come home in the evening, they stop off by 10 subs and everything, and they're only going to eat one, but they can't stop. They cannot stop themselves from eating. They don't go purge, they don't go whatever, they're not, it's just one of those kind of mindless things that they'll do. So when they're treated for their ADHD, actually that diminishes because they have much more control. They can say, oh, I'm going to the gym, I'm in a routine, I've got, I'm going to meet my friend. They're able to organize and schedule other things, so that's not a big thing in their lives anymore. But there also is the binge eating disorder without ADHD, and they actually have used psychostimulants in those people, and they'd be beneficial for them as well. So it's not an appetite reduction thing. It's because that wears off usually in most after a while, if you have it, but only 20% or 30% have that anyway. So that's not what it's about. It's about the control, stopping and thinking before doing something, okay, empowering. Often people ask that, do medications, stimulants, other meds work as well for females as they do for males? They do. But I think way back in '84 or something, when they did a small study, and there were only very few females in it, and they weren't probably titrated the way we titrate things anymore. They said, oh, it didn't seem to work the same. But since then, absolutely, that's been a consensus. And that's what I found in my practice too. Everybody's unique and different. Everybody needs to start low, go slow. Everybody needs to find the medication that works for them if they're going in medication. And the benefits always have to outweigh the negatives, no matter what we're talking about, whether it's strategies or whether it's meds or a combination of both. This is a study called the Multimodal Treatment Study, MTA, and this was, these are the results from 1999. This was a landmark study in ADHD because they actually went into it hoping to prove that psychosocial alone and social skills would be kind of the CADDAC approach for treating ADHD, and that meds would come out as more secondary. But what they found actually was that medication in community care, just sort of haphazardly given, see you in 2 months, never titrating the dosage, not monitoring, people give up, versus psychosocial alone, very intense summer programs on their own, versus the other one at the 56% was medication alone, but that was different. This was tightly monitored in the research group. They got phone calls, they got their saliva tested, because people say, oh yeah, they said they're taking their meds and they forgot. So, you know, they could say whether they were on it or off it. They got pep talks, they got, you know, so they were still in contact and were being tightly monitored, and they were going up to optimize their meds to the very best for them, or it was too high coming back down. So in the community, they weren't doing that. They put them on one dose maybe and left them on it. Didn't work, and they stopped taking it. And then to the combined, going to the combined one, which is the 68%. As you can see, combined treatment, which is psychosocial plus medication, is really the CADDAC treatment. I don't know how you can almost do one without the other, but certainly the meds, pills don't give you skills on your own, okay? It may make you more focused so that you can now avail of the strategies that you've been taught, and now you can actually start to use them, or it opens up your mind to say, oh, that's what they meant. I mentioned this morning, sometimes people have no idea what focus is all about until they're actually know what it is like to focus on what other people are talking about. That's like me and my glasses. Didn't know that there was another world besides being blurry out there when I was becoming a teenager. And when I put up my glasses and I went to the ophthalmologist, in the same way as you titrate your meds for ADHD, start low, is this better? Of course, is this better? Yes. Is this better again? Yeah. And then maybe it's too much and you go back. And I remember the first time putting them on, sort of snuck them on my face, and a double-decker bus in Dublin. I'd been taken out by the teachers to get this done. And it was like a whole new world. I put them on and I could see, oh my goodness, the trees are not just one great big green blur. I can see the leaves crisply. There are all these different leaves. I mean, I knew that years ago, but when it's gradual and you come to accept that that's the way you just assume it's like that for everybody. Same with ADHD, if you don't know what other way there is to live. So it can be a revelation for them, and they can really help with their skills. So the girls in particular do very well with the combination, particularly with anxiety. Now, the only disadvantage with this study was that they're all combined type, the ADHD combined, hyper and inattentive, impulsive. And there were, about 25% of girls, but it's still, they followed them for over years and looked at all the changes. And these are the meds that are available in Canada. I'll just, for those of you who weren't here this morning, the CADDAC guidelines they've set the guidelines for Canada on how to titrate medications. They give you a great overview about what's out there and how to start, and some sort of maximums and minimums. They're not always the same. I can have huge people and tiny amounts of medication. I can have little guys on huge amount of medication without side effects, but that's what they need. Okay, we have each end of the spectrum, the really low, the really high, and then kind of the average in between. So on this one, it's interesting because they give you what's unique about this is they give you what the drug companies are allowed to tell you, and they're only allowed to tell you up to 54 in Concerta or up to whatever the dosage is in something else, because that's what the product monograph says. That's what Health Canada and FDA and whatever, that's when they've done their studies up to, or they've done some more. But the other side tells you what the clinicians and experts out there have been using for years and generations, and what works. We have to make people go really lower, because some of them want to start some of the big men on bigger dosages, and we say absolutely not. It's not a weight-based. Stimulants are not weight-based. The second-line medications are weight-based. The Strattera and the Intuitive, which are second-line and take longer to take effect, they're actually weight-based. But in some people, again, I have some people who need smaller and higher than their actual weight. Okay, and then there's some side effect things in the back. And while I'm at that, I just want to introduce you to the fact that at CADDAC, I've been on the board for 6 years, worked hard, and particularly on this one, it's the psychosocial sheet, okay, and interventions. And this is just hot off the press. We had it for our conference at CADDAC 2 weeks ago in Ottawa. And so the kind of two goes together, the pills and the skills, or vice versa. And on the back, so it tells you a little bit about psychoeducation. Discussing the diagnosis and explaining what it is very empowering, okay? And on the back, it gives, especially for physicians who feel that they don't have the skills in this area, they just know about the meds, and we're trying to help them on the forefront to get more involved, this can be a little tool for them as well. Well, they can just tell you two things. Okay, make sure you get eye contact or gentle physical contact before giving one or two clear instructions, and have them repeated back to you. Because many people shout across the room and get mad because a kid hasn't heard them, and it's 10 times they've been shouting. So that was mostly my lecture this morning, but I just wanted to draw your attention to that. They would be on the CADDAC website. So the two classes of medication, we have the methylphenidate and the Ritalin family, and we have the amphetamine family, dexedrine family. And I don't want you to think every time you hear in the news that we have breaking news, millions of dollars of methamphetamine was found in so-and-so's garage. It's not the same. It's a completely different compound, okay? So again, start low, go slow until the benefits outweigh the negatives. Just to show you some of the things that can happen also. Writing can improve. The math skills and careless errors can diminish. So how about hormonal influence? Okay, I think this is really very pertinent for all the women, because people don't realize that estrogen is a target, the brain is a target organ for estrogen, okay? And estrogen is responsible for mood changes, cognitive, short-term memory, etc. How many people going into perimenopause or menopause will complain, oh, I've forgotten this, I never used to be like that. That can be common, ordinary menopause, but if you've got ADHD and you're going into menopause, if you were just sort of teetering, just barely keeping it together because you've done all these compensatory skills and you're, just keeping, your life on just in that crisis, not crisis, but, just sort of don't let anything go wrong here. And then menopause can come along, then it can send you over, okay? Because now you got the double whammy, because you already had short-term memory, executive function problems, and we know that can hormonal influence, or menopause can, and perimenopause can really influence that. What's really interesting is that they have now done, looking at two studies that have been done, and looking at menopause alone and executive functioning. Are these women all crazy? Are they, well, how come they're all saying, I forgot this, or I lost this, or I'm more anxious, or I'm not handling things the same way? Well, they're not sleeping as well, their night flashes, the day flashes, their sleep's disturbed, so all of those things add up as well. So what they looked at was that this group of women, the first study they did was actually with Stratera, a small group, and it looked as if it benefited them when they looked at the scores and the questionnaires. Now, they didn't go for a high rating. All of these studies, you had to be excluded from having ADHD. So they were excluded, not meeting criteria. They took a much lower level on the questionnaire, and the questionnaire they used was the Brown's ADHD questionnaire called the BADS. And I think we're about 40 in each group. And so they did one in Stratera, and it helped bring down some of their symptoms. They were improved. They felt that they had improved executive function, and they used 5-ounce as well in another group, and again, the same results. However, these are only 2 small studies, but it is certainly interesting. Of course, puberty, you all know, having, I'm sure, lived with some teenagers, and there's nothing worse in a house full of teenagers being hormonal, and maybe their mothers also going through perimenopause and menopause. It can be the straw that breaks the camel's back at times, and nobody's understanding the other person, and they think, oh, they're depressed or they're defiant, so sometimes I have to stop people and say, well, this is what's going on, so the girls, again, we have the estrogen increase around that time, and what happens with the girls is the estrogen can also have an effect on dopamine receptors. And so they're starting to more increase in the prefrontal striatal area around that time. The boys have had their increase way before that, okay? And so the boys' symptoms may look as if they're kind of coming down because they're less hyper. And the girls now, we have thrown in middle school and all the demands of executive function. And now we have hormones on top of that. So that, again, can make them look bad for the first time, or people not know what's going on, what they need to compensate with. And we have, that could go on for the life cycle of some females who have premenstrual disorder, okay? So everybody, all the females have to some degree, some disturbance, maybe physically or whatever, just before they have their menses, and then, but others have it to a really severe degree, really severe, so much that it's called dementia, not dementia, premenstrual disorder, dysphoric disorder, right. And so some of those people have actually required treatment for that, like SSRIs, but they've only required it for a week at a time. I mean, that sounds strange because it's supposed to take a long time to work and a long time to go. But in this disorder, it works differently from depression. So there's some people, they're really at the severe end, not many people like that. And then for some of the other people in between, it may or may not be that they might benefit from, some of the kids go on cycle regulators, the pill, hormonal, estradiol for the perimenopausal or menopausal. Of course, there's all sorts of controversies about being on hormone therapy, so that decision would have to be made between you and your doctor. I do have people who have been successfully treated on that. So we also have the thyroid hormone that can influence people. And women have a bigger thyroid than men, and estrogen can really block the thyroid effects. So they have looked at studies, again, it affects mood and cognition and short-term memory. So you have to keep that in mind when you're going through the list of ruling in or ruling out, a new onset ADHD, worsening of ADHD, what's happening here. And they have, there's been a study as well, looked at subclinical. Sometimes women have lower thyroids than is at the norm, and it's subclinical. They're not coming in and presenting that they're gaining weight and that they're tired and things like that. And they've done a study on those, and they've actually benefited from some thyroid replacement with their working memory as well, some executive functioning skills in there. So what brought all of this to my attention, was that, I wanted to point this out too, that sometimes people are very successful in their management of ADHD, they're on their meds, they're working well, and lo and behold, they say, oh, the week before my period, doctor, I don't know, it doesn't seem to be working as well, or I feel as if it's too much or too little or whatever, and they might experiment and change their dosage a little bit. And it's rare, but I have had patients who do that. And this girl, Hormonal Hillary, I'll call her, she'd actually brought that to my attention way back, because I never thought about this hormonal influence. She was 15, she had been diagnosed with ADHD shortly before that. She had diagnosed with an LD as well, but she was put in a lower functioning class, lower than she should have been. And she was kind of frustrated. She wanted to be in a higher level English class or whatever. So we talked about it. We got her ADHD treated. Concert had just come on the market. That was 2002, I think. And again, we gradually went up. 18, the very lowest dosage, wasn't enough. 36 was too much. You know, the signs of too much can be either you're subdued or over-focused or irritable or cranky, or you're like you've had too many cups of coffee and you're talking too much and moving around too much, okay? So that seemed to be just perfect for her. But in the meantime, they also noticed this kind of pre-menstrual didn't seem to be right. So they experimented. And what they found was that during that particular time, she literally found that even though the 18 was too little for her at other times, at that particular week, it was perfect for her. Okay. Now it can go either way. It doesn't mean that everybody has to go down. It could be that you might need to increase it. It depends. Okay. If there anybody, you know, out there, if that's a concern for anybody, you can always talk to your doctor about that. There is some stuff in the literature about it, but people just don't seem to think about it. Okay. So IQ may not always reflect true potential, particularly when your ADHD is not under the influence of medication and treatment, and always think about the impact that this could have. So unfortunately, we do have some sinners in females as well as males. However, conduct disorder and oppositionality disorder are not as high, but they can certainly be there and very impairing as well. I mean, I only have a little picture of a boy, but you know, sometimes that's what the psychologists and other people feel like doing with them because nothing is working. Parents are fed up, you know, ready to give them away, whatever. It says, that's the best I can do. If you'd like to see another child psychologist, okay. So what happens with the females, they even have more significant impairment because now we have friendships that are harder to maintain. It's harder work to keep up conversation, etc. And make the dates and get back at the organization and which the girls are expecting. So they get into all these, can get in, if they're impulsive as well, get all these risky behaviors. And they may never have done, they may have been perfectly good. Now they're being accepted by the peer group that are at risk. Oh yeah, come on, we'll do this, you know. So then they get into literally sex, drugs, and rock and roll. And often the gateway to that is with cigarettes, you know, out hanging out. And then that's the gateway into the drugs and alcohol, and then the wrong crowd. So, and then of course we have the pregnancy, and that's why often there's a higher incidence of ADHD in adopted children, because if you think about it, it wasn't planned. There were two maybe impulsive people who came together genetically, may have one or the other, they've had ADHD, and then they grow up and they find that out. So what happens to them? This doesn't happen to all, but they can end up in prison. And they've done numerous studies now looking at the prison populations, both in males and in females. And they have found that not only do they find a lot of individuals who have missed diagnosis of learning disabilities, which can impact their progress and their ability to get jobs and understand even what maybe they're confessing to and the whole thing, but also undiagnosed ADHD with the impulsivity. I mean, they do the silliest things. I've had kids and they walk out with something in a store that everybody can see them, they don't need it. I think somebody took a tuxedo once. I mean, they weren't even going to wear it or anything. You know, just silly kinds of impulsive things. So these people, Rosler in particular in Germany and Hennessy, have shown that women, compared to their non-ADHD kids, really have a terrible time. They have more incidences of homelessness, more incidents of emotional trauma and substance abuse than even their male counterparts, and certainly the women without ADHD. They have longer incarcerations, earlier go to prison. How about the scholars? We have them too. We have lots of gifted kids, and it can be very protective for a while, but then, you know, they don't have the study skills and they need to stop and think before they say and do things also. So what people say, well, how do you know that they're gifted, that it isn't just the giftedness and they're bored? Well, the gifted kids can usually get their work done, and then they're up moving around and asking for stuff and annoying people because they truly have the work done and they're bored. If you're ADHD, you never get the work done to actually get on and do the exciting stuff that they've sent for you. Oh, we've got you for the bright kids and everything, but they can never get the humdrum stuff off and done to get to that. So that's kind of a bit of a clue there. And I love the far side one, which says, pull on the door, right? And he's pushing, and it says, Midvale School for the Gifted. How many of you have found yourselves doing that often? There, you can just classify yourself as gifted. This girl, she was very interesting. I won't go into her whole history. It was way back, but she had verbal diarrhea when you were talking to her and focused on her in the office, blah, blah, blah. Really interesting. I'm queen of the nerds and da-da-da. You know, the minute you weren't talking to her, she looked like she had changed personality. She was just gone off into her own land. So physically engaged, intention engaged when it was all about her and her focus of interest. Other than that, she was off in la-la land. Organization, absolute disaster. She, again, it was the same time Concerta came out. She did well on it. But do you notice that we're titrating the dosages up? There's no such thing as a 45, but you can do that by adding 2 pills together. Makes it more expensive, though. She was much better. She used to tell me that getting down to homework was like brushing an alligator's teeth. Now, who on earth would have ever thought of that? And she said, oh, and all had all those thoughts, endless thoughts bouncing around in my head. It was almost painful. So when she went, she said, on the Concerta, because now she was able to focus on one thought or whatever at a time, she said, it was like a laxative for the brain. I was able to focus on one thought at a time. And it was like a garage sale. You know, you want to keep everything, but sometimes you just have to get rid of some things and just focus on the others, you know? So just the way she described things for me, it was very entertaining. And her whole family had ADHD, by the way. Mom realized she had, but she was functioning. She was one of the ones who had an organizer. They were both professors, blah, blah. I would go on. So we also have to think of the daydreamer, just sitting in front of the teacher just looks as if they're with you, but they're, again, way off. And they're the ones that often get diagnosed with an anxiety disorder because when they're called on, and they have no clue about what topic we're talking about or what the question was, and it's just like they're flustered. panic, and then people think, oh, they're anxious, they can't put their hand up, they're afraid. Well, if you actually talk to them, they'll tell you why, because they drifted off, they want to do well, but wow, it's so embarrassing now, so they won't put their hands up. And they may kind of just work at a bit of a slower pace because they're always drifting off and reading the same thing over and over. They get told they have a reading comprehension problem, and half the time is that they're reading, their mind wanders, so they read the same paragraph 10 times and then ask them a question about it and they don't know what it is. So then people shouldn't get confused that they have an actual reading disorder. And then with anxiety, oh yes, I have people who can't let go of their anxiety. Well, actually, this one says, then one morning I woke up and I found I had nothing to worry about, and that had me worried. Well, anxiety can run in families as well. It's genetic, like ADHD. Not as genetic, but sometimes the kids can have some anxiety traits for true, because they're going to lose, forget, not be on time, etc. But the parent who has some anxiety may be hovering around, be careful, don't go in the street, So sometimes it's like ADHD epigenetic, okay? I also, before I go on, I also had a child, at nighttime, they can't turn their thoughts off and they're worried about what it is they might have forgotten, but they're not sure. So that's a bit of a worry. And then there was somebody else said, my parents and school kept thinking that my anxiety was interfering with my focus. But in reality, it was my focus that was interfering. Sorry, did I get that? My focus was interfering with my, what did I say? No, they thought it was anxiety was the main problem, and that's why they couldn't focus. But the other way around was they couldn't focus, so they were anxious. So keep that in mind. And of course, what would we do about his, mine, yours, theirs, and the others? So this one says, which is pretty common nowadays, this is my husband's second child from his third marriage. She's my first child from my second marriage. And I don't know who the hell he is. Kind of like well, not quite the Brady Bunch, but that's what's happening. The reality, people have different multiple relationships. They're coming and going at different weekends. There's, family trauma over that. One isn't speaking to the other that we talked about in some of the families who are divorced. Others are communicating well, but the apple doesn't fall far from the tree, and the parents might have ADHD, and they're always forgetting their laptop at one place and their socks at the other place, and etc. So it's a really good idea for them to have maybe double sets of things if people can afford that, because and a list for each house of what it is they're supposed to go through it before they go from A to B. And that will save mad panic car drives back and forwards over the city to try and get some of these things. So I think you're very well aware that it is highly genetic. Okay. Now, I'm not going to go into this one. If we have time, I'll try and do another case, but this is just to say that people sometimes get worried about being on stimulants when they see a tic. Just want to say that, about 29% of kids over their lifetime up to, 10 or thereabouts may have a simple tic. They may have a little twitch, a little eye blink, little something or other. It's no big deal. It usually goes transient. However, if you've got a tic disorder, then it's going to be chronic. You may have multiple shoulder, head rolling, eye blinking, moving your mouth, your foot, whatever it is. And that would be called a motor tic, chronic motor tic. And then some people only have a vocal one. I'm sure you've been beside people who do that all the time. And then they get labeled as having allergies, GI reflux, numerous things. In actual fact, it's just a tic. Okay. If you ask about the families, sometimes they notice it. They'll say, "Oh yeah, Uncle Joe does that." Half the time they say, "No, there are no tics in the family." And I'm actually looking at a parent, and they are ticking away, and they have no idea. And the wife or the husband doesn't even notice it either. Or I've had one wife say, "See, I told you that was a tic." He was doing this with his head. "No, I just got a sore neck." Everybody thinks that there's some reason for it. Okay. It's like a habit. It just becomes, it's involuntary though. You don't plan to do it. But afterwards you think, well, maybe that was the cause. Sniffing, snorting, squeaks, and other things can also be connected with that. But unfortunately, if that happens when they're on meds, sometimes the meds get blamed. And a med that was a perfectly good medication, and they may have just a little eye blinking, gets switched, and they keep switching because they think it's causing the tics. The natural time zone of tics is, anywhere from either preschool or older, but usually might notice it when they're older, and it gets a little worse around teenage, and then it can disappear. And because you don't see many adults with this, but you will see. I always happen to sit beside one in a plane. I don't sure with the sniffing. So just to say that sometimes that happens, but it's a coincidence. It's genetic. Ask about it in the family. You have 60 to 90% of people with Tourette's, which is both motor and vocal, will have a huge incidence of ADHD, but not vice versa. Okay. So anyway, this is a family, and the thing with her was the mother had Tourette's and she had ADHD, diagnosed way back. And there were sleeping difficulties, anxiety, anger, the whole gambit. And dad went to work, but he came home, and I think he self-medicated with the beer. And the older sister had some obsessive tendencies, and I didn't blame her because there was a lot of chaos going on in the home. And so probably she wanted her own little space in her room to be kept tidy. Okay. She was tried on some different meds. Mom was very impulsive, so when she tried her on Adderall, I do by step, 5, 7.5, even it doesn't exist, But she impulsively gave her double dosage, and then the kid obviously had too much, so she was hyperactive and talking too much, and she took her to emerge rather than saying, she'll be fine the next day, it'll be gone. That kind of family. But the girl also was on the overweight side, and she had no friends, and she was being bullied, and a whole lot of things. So for her, what worked was Vyvanse medication, and in conjunction with guanfacine, which is it wasn't the new one, but it is the new one called Intuitive, which also helps with ADHD. You can add it on. It's similar to clonidine, which was available for years here, and we knew that would help with emotionality, aggression, oppositionality, focus, and so I won't go into that again too much, but you can add on in some of these kids, and she was certainly very severe, and that also can help with tics. So. But of course, she had lots of interventions. She saw the dietitian, she had counseling, the family had counseling, they had they had school support, and she got involved in martial arts. She was doing some exercise. So she had the whole gambit, which really worked out well for her. Her quality of life improved, she was sleeping better, her academics had significant improvement, and there was a lot more harmony in the family. Mom actually got her medication onto a longer one as well. So now they got along much better. We didn't have that toxic twosome. We had more like people who could understand each other and get along better together. So this one, I think this is often the typical girl. And I saw her about 2 years ago, and the expression street angel, house devil comes from my mother because she said that she had a brother growing up. She had a big family, and she said, yeah, he was always charming outside, everybody loved him, but he could be a little devil at home. It's kind of like a street angel, house devil. She's Irish, so I thought, oh yeah, that's good, it kind of explains it. So she was in school. She was in grade 5, she wasn't achieving, she was starting to fall behind, she seemed like she was well behaved, etc. at school. And is it a skill problem with ADHD? Not usually, it's a production problem. So she could read, she knew her math, but she'd make the careless errors, she didn't get her things handed in, she didn't get them finished. So the parents took her for an evaluation of, well, does she have a learning disability? So, because at school they were having a lot of problems at home, when she'd come home, again, that toxic thing, she'd explode, have her meltdowns. The family and the siblings were kind of really afraid of it and just weren't really sure what was going on. However, they came to our clinic, and the red flags were dad, who was professional, already was diagnosed with ADHD. This is the other way around, because usually it's the kid first. And he was successfully treated on, I think he was taking Concerta. His uncle had dyslexia. So that's really just the Greek name for having difficulty with reading, learning disability. But have a look at this picture. Isn't that an amazing picture? This is a self-portrait, because this is what she said to me. I didn't ask her, which maybe I should start asking people to draw, but I couldn't draw like that. I'm sorry, mine would be a stick person or something. So she said, look, see the big smile? That's me. So gay, that's what everybody sees, you know, outside. She said, look at this. This is what I see. This is what I'm feeling with the frustration and the lack of control. Make it stop. Isn't that amazing? I just thought, pictures speak louder than words for sure. So it was pretty serious. It might not have looked serious even in the school situation, but it was pretty getting serious for her life. She was keeping up with friendships and everything. So she was diagnosed with ADHD, inattentive, no learning disability. Lots of strategies were given for home and for school, and the parents were very good at carrying them out, I must say. Because her dad was on Concerta, it seemed like the place to start, right? Same class of medication, methylphenidate, and why not? Well, we tried her on that, but it actually wasn't beneficial for her. So then we tried her on Vyvanse. She had better focus on that, but she had a rash, which is kind of rare, but you know, these things can happen. Then we retried the Concerta. Well, so let's try that again. Maybe we're missing something. No. But then bifenton was tried, which is the same family as Concerta. Okay, they're both methylphenidate, but they're different release systems. Okay, the Concerta, if I had it here, I'd show you. It's kind of the methylphenidate's on the outside, and inside you're left with a very sophisticated, it's called Oros delivery system. So you can't cut it or anything because you'd ruin that whole technology. There's a little space at the end, and the medication is in the middle, and then the fluid from the intestine kind of pushes it out gradually throughout the day. The bifenton, even though it's the same medication, it's a capsule. There's one spatule in it, the white one. And with that, 40% is released in the morning, and the rest kind of throughout the day is released. Okay. So some people will say, if you've tried one class of medication and you don't work on it, like if you tried a Ritalin medication, it doesn't work for you, won't work for anything else. Or vice versa, you've tried a dexedrine type of medication, doesn't work for you. But that is not what I have found over the clinical years. There's no litmus one to say which one is going to work for you best, but there is nothing to stop you from trying, because I think that your metabolism and the delivery system seems to make a huge difference. Otherwise, why would Vyvanse work for one person, but Adderall doesn't, or vice versa, and bifenton works, but Concerta doesn't work, same class. So sometimes physicians will tell you that. I know, because the people who are referred into my clinic and have had pediatricians or family docs, some of them think that from way back, and they'll tell them that. So just, you can be assertive and just say, well, actually, I've heard that, you can still try it. What have you to lose? Nothing ventured, nothing gained. The great thing about the stimulants is they act very quickly, and you can decide whether they're working or not, stop them immediately or not. You don't have to taper off, which you do with the Intuitive or the Strattera. Okay. So what happened? She was doing better academic, because now she had the skills, but she was able to increase the productivity and complete her tasks and hand them in. She had better social interaction because she was able to pay more attention and improve conversation. All her relatives said, and that's another thing I meant to say. I often hear that, wow, I had a conversation with my child for the first time. It's because their thoughts are all over the place, they're hopping the topic, and you have to backtrack to see where they're coming from, or they can't keep up with your conversation and they're already blurting out about something else. So keeping on the same wavelength can actually have a great backwards and forwards conversation. And parents have noticed that, grandparents have noticed that, and they noticed that with this girl as well. However, medication was wearing off around the witching hour, 6 or so, which actually for bifenton is not too bad. I know it's supposed to be 10, 12 hours, but sometimes it can be less. So here we are, but she was still having difficulties at home. She couldn't with the homework and with the fighting and with the parents. So what do? Do we just say, in this case, it's good enough? We can manage, we're doing fine. Do we try another med? We've already tried a few. Remember, it is very beneficial. We're just having those evening times. Do we add a short-acting medication in the evening? You could do that. Sometimes people do that because they need to get to their hockey practices or whatever it is, and they need to be focused during the evening. That can have two things. It can either help you with your evening, and there's no problem with your sleep or your appetite, or the short-actings sometimes come on with a bang, go off with a bang, and it may not help with your sleep or may interfere with your appetite. So there's something to weigh up and down as well. Do we try a different class of medication altogether, like the Strattera or the guanfacine, the Intuitive? Or do we add on and just go it alone, try that on its own, or do we add on something, and what do we add on? So we talked it over, the family, all of us, and decided that we would try adding the alpha adrenergic one called the Intuitive. And that can be wonderful or it can be awful. It really depends. It's supposed to be 24 hours. Sometimes it is, sometimes it isn't. That's why I like to add it in the evening time, particularly if the behaviors are a problem in the evening, because it can also help with sleep. But I have some people that it makes their sleep hell too, and they're waking up, and I have to change it to the morning, and that's better for them. But I find that starting in the evening, then it may help with, one of the side effects is you can become sleepy in the beginning. So putting it after supper or just before bed will help, okay? So we did that, and it was titrated up. You titrated up 1 milligram, minimum weekly, sometimes 2 weekly intervals. The top for her was 3. She tried 4, she had negatives on 4, but this really worked for her. And even on that one, usually I haven't heard that one, but even her writing improved on this. Probably because she was maybe doing more work in the evening, and this was helping her stay focused. This also can act as a synergistic medication. So there are trials out there that show that when it's used in combination with the stimulant, that maybe you're not able to go high enough on the stimulant without causing some negative effects, but adding this in may be an additive positive effect, not just in the evening, but actually during the day. It can give it better. On the other hand, I've had kids start on it. It's the worst thing ever for them. Their sleep's worse, their mood's worse, etc. So you just stop, okay? It's like anything else. So sometimes, and lots of times I always say, parents can know best. They know their children really well. It's very difficult for the teachers to get to know the children, in just, maybe especially if it's September, October. How can they? You've got sometimes 30 other kids to know, and they may not see them in all situations. And sometimes the parents have no clue because they just see them at home playing their video games. So they're not active looking, and they're not demanding if the parents let them sit 3 hours in their videos, because they're allowed to do it. But I'll always curtail that time, and I'll say it again, not before bed. Cut it off an hour before bed and take away the video games, the electronics, lock them away, because otherwise they're going to get up at night and start looking for them, and that happens. So that's how you do that. And every research across the world is coming out and saying that having electronics in the bedroom is bad for everybody, especially even adults. You can't turn your brain off and the lights and the whole thing. Reading is really good though, and music, just throw that in. So remember that it's always quality of life. It's not just whether you're getting your math right, etc. And listen to your patients, because a lot of these girls in particular, now there are some questionnaires that are very specific for girls out there. If you look up ADVANCE, ADD, capital VANCE.com, Patricia Quinn and Kathleen Nadeau have a magazine or a site where they have lots of good advice, and the questionnaires that are very specific to girls are theirs. They're not used in a routine basis, but sometimes we use them in our clinic. They're called the SASI, S-A-S-I, ADHD sensitivity, I can't remember, but anyway. So just a couple of those things that are, and they have some great books as well. So they're just apart from the regular books on parenting and ADHD and relationships and ADHD. I think more is known about that. So summary of what we've talked about. to be aware that anxiety can coexist. I think when you have somebody coming in to the office of your primary care or psychologist, teacher, if you're seeing anxiety, nurse, whomever, family therapist, across the board, then think, screen, could that be ADHD? When you see ADHD, screen and think, could that be anxiety disorder or just anxiety traits? And the same with depression. Learning disabilities, you know, they say they don't understand, but they can read that book on Harry Potter that they enjoyed so much, yet, you know, ordinary homework in the book isn't interesting for them, they can't keep their focus. So there are all of those things, ruling in, ruling out. And a lot of times when ADHD is under control, a lot of those other symptoms disappear or become more manageable. Sometimes you actually have to treat maybe the anxiety or the depression as well, but being on a stimulant doesn't counteract that. Sometimes instead it just makes you available for CBT, which is terrific, and now you can treat your anxiety that way. But if you happen to need a med as well, then you can use an SSRI along with a stimulant. You know, they'll potentiate each other, but it can be managed as well. Everything has, but you always have the most impairing condition treated first. So ADHD is the most impairing. In a lot of cases, you treat that first. Somebody comes into your office and they come in to look at ADHD, but in the meantime, they develop severe depression and they're sad and they're suicidal. I mean, obviously, you're going to be getting the depression looked at first. Forget the ADHD. That can be looked at later, okay? We talk about the hormones. Remember about the hormones. And switch medication if you're not getting all the benefits, or if they're working well for you, but the side effects are just something you shouldn't have to deal with, switch. That's the beauty. We have choices now. They're all good. Just have to find the one that works for you. Long-acting, long-acting, long-acting. Honestly can't know how a person could be able to remember to take their Ritalin or Dexedrine 3 or 4 times a day. Be like me having to, as I said, go through my day without being off my glasses for an hour here and another hour there. And certainly not at weekends either. We have the same impairments, maybe sometimes worse if it's more unstructured, the situation, and there are more social engagements. So we'd love that all the meds were covered. I'm not sure what happens in BC. They're not all covered in Alberta. It's become better. You actually are having more of a problem, I hear here, that the government want to go to the short acting because it saves them money. And they don't seem to be interested in the quality of life and other things. Heidi's been dealing with some of that. So I think with that, I will end. And I think you've been a terrific audience. Really, wow. You've all kept your focus because I've been looking around. It's amazing. Okay. So thank you very, very much. And I hope this has been helpful.
I'd really like to thank Dr. Farley for flying in from Calgary and volunteering her time and expertise for the 2 talks she gave today and giving up her weekend to join us. Help me thank again Dr. Farley.
Pleasure.